today's topic is breastfeeding. Okay, আচ্ছা ব্রেস্টফিডিং এর টপিকে যাব তার আগে ব্রেস্টফিডিং এ আগে বোধহয় পড়ানোও হয়েছে। কি আইডিয়া আছে ব্রেস্টফিডিং সম্বন্ধে, ব্রেস্টফিডিং কখন স্টার্ট হবে আর কখন এন্ড হবে, কখন শেষ হবে, মানে বাচ্চার বয়স বলো কখন। এক্সক্লুসিভ ব্রেস্টফিডিং আপ টু 6 মান্থস। কখন ব্রেস্টফিডিং স্টার্ট করব? সিজারিয়ান সেকশন হতে পারে, নর্মাল ডেলিভারি হতে পারে, দুটো কেসেই কখন আমরা স্টার্ট করব? উইদিন 30 মিনিটস, উইদিন 1 আওয়ার, বাট টার্মটা হচ্ছে অ্যাজ সুন অ্যাজ পসিবল, প্রেফারেবলি উইদিন 1 আওয়ার, বাট অ্যাজ সুন অ্যাজ পসিবল। যদি আরও আগে স্টার্ট করতে পারি আরও আগে, ঠিক আছে। আর কতদিন কন্টিনিউ করবো ব্রেস্টফিডিং? 2 ইয়ার্স, ঠিক আছে। 6 মান্থস এক্সক্লুসিভ ব্রেস্টফিডিং আর তারপরে আপ টু 2 ইয়ার্স। আচ্ছা আচ্ছা, ব্রেস্টে মিল্কে সব রকম নিউট্রিশন তো থাকে, কিছু আছে যেটা ডেফিসিয়েন্ট থাকে, কোনটা, কার্বোহাইড্রেট না প্রোটিন? প্রোটিন কোন মিল্কে বেশি থাকে? হিউম্যান মিল্কে। কার্বোহাইড্রেট বেশি কোনটাতে, হিউম্যান না কাউ? ঠিক আছে, আছে স্লাইডে সব দেখাও। হিউম্যান মিল্কে কার্বোহাইড্রেট বেশি, কাউ মিল্কে প্রোটিন বেশি, বাট হিউম্যান মিল্কের প্রোটিন বেটার কোয়ালিটি, অফ বেটার কোয়ালিটি, হোয়ে প্রোটিন বেশি থাকে, কোয়ালিটিতে বেশি বাট কোয়ান্টিটিতে কাউ মিল্কে বেশি। আচ্ছা, সব স্লাইডে চলো। Breast milk contains all the nutrients for optimum growth and development of a neonate from birth to 6 months. Exclusive breastfeeding up to 6 months. Exclusive breastfeeding means only breast milk, nothing but the breast milk, but vitamin drops or any medication if indicated, that is permissible. And 6 months to 2 years complementary feeding plus breastfeeding. From 6 months we will start complementary feeding, and this is also under IUICF, infant and young child feeding, IUICF program. Okay, social program. Under this program up to 6 months breastfeeding and up to 2 years complementary feeding plus breastfeeding. What are the benefits of breastfeeding? First, nutritional superiority, contains all nutrients for growth and development of neonate. Then carbohydrates, lactose, how much? 6.7 to 7.8 gram per deciliter, and it absorbs calcium and enhances growth of lactobacillus, and lactobacillus is good bacteria, and galactose forms galactocerebrosides. So basically lactose and galactose are carbohydrates. Then protein, how much? 0.9 to 1.1 gram per deciliter. It is in term, for term babies. In preterm milk the protein quantity is higher, okay, around 1.8 to 2.2 gram per deciliter. And what are the types? Lactalbumin and lactoglobulin, and contains taurine and cysteine. These are necessary for brain growth. These are not available in formula feeds. Fat, rich in polyunsaturated fatty acid, which is essential for myelination of neural tissue. Human milk also contains omega 2 and omega 6 fatty acid for synthesizing prostaglandin, and contains cholesterol for synthesizing steroid hormone. HMO, human milk oligosaccharides. This is non-digestible carbohydrate, means prebiotics. Prebiotics, what are prebiotics? Non-digestible carbohydrate. And probiotics are good bacteria. Bacteria is good for our gut or our health. Human breast milk contains vitamins and minerals essential for growth and development of neonate. Water, 88% of breast milk is water, okay, to meet up the thirst of newborn or neonate, and it also contains all electrolytes. But breast milk has less solute load, so that there is less pressure on kidneys. Okay. Immunological superiority. The contents are secretory immunoglobulin A, macrophages, lymphocytes, lactoferrin, lysozyme, bifidus factor, interferon. All of these have immunological role for better immunity of neonate or infant. Mental growth for higher IQ and benefits to mother. Breast milk or lactation has also some benefits to mother also, like for uterine involution. It reduces risk of postpartum hemorrhage and lactational amenorrhea. What is lactational amenorrhea? Mother or women are less likely to conceive during lactational period. That is lactational amenorrhea. Composition of human and cow's milk. যেটা আমি জিজ্ঞেস করছিলাম। Now see. Protein in human milk 1.1 gram, but in cow's milk its quantity is higher, 3 gram. Okay. Casein is to whey protein. Casein protein and whey protein ratio in human milk 40 is to 60. Whey protein is more in human milk, but in cow's milk casein protein is more, 80 is to 20. So quantitatively protein is more in cow's milk, but the quality in human milk is superior. Lactose fat content in human milk is more, 7 gram, and in cow's milk 4.5 gram. Calories are same, 67 calorie in human milk and cow's milk at the last. Then essential fatty acids 13% is more in human milk. Calcium to phosphorus ratio more than 2, in cow's milk less than 2. Sodium 0.7 milliequivalent in human milk. So less sodium means less pressure on kidneys. So because kidneys of newborn or neonate are not matured, okay, immature kidneys, so less solute load is helpful. Osmolarity 7.9 milliosmol in human milk, 22.1 milliosmol in cow's milk. So cow's milk is highly osmolar. Calories both are same, 67 calorie. What are the contraindications of breastfeeding? If mother is on any anti-thyroid drugs like carbimazole, methimazole, okay, or any anti-cancer drug, then this is a contraindication. Mother should not feed her baby. Intake of drugs like radioactive compounds, lithium, okay, and if baby is suffering from galactosemia, okay. So but HIV, TB, tuberculosis and hepatitis B in mother are not contraindications to breastfeeding. If mother is suffering from any of these, either HIV or TB or hepatitis B, we will continue breastfeeding. Okay. So this is the anatomy of breast. Now breast contains few lobes, few lobules under those lobes, and in those lobules there are milk secreting cells. Prolactin makes them secrete milk. Milk secreted from those milk secreting cells, and around those cells there are muscle cells, myoepithelial cells, and oxytocin hormone makes them contract. Okay. So, oxytocin basically let the milk down through the ducts. These are smaller ducts and join, then form larger ducts, ultimately lactiferous sinuses. So, breast milk from milk secreting cells through ducts ultimately goes into lactiferous sinuses. Then when the baby suckles nipple, then it comes out. Prolactin reflex. Prolactin mainly responsible for milk production. So, whenever breast sucking by neonate suckles breast, then nerve impulse goes to anterior pituitary. Baby suckling, sensory impulse goes to anterior pituitary. From anterior pituitary, prolactin released, and prolactin's functions of prolactin is milk production. Okay. Prolactin acts on alveolar glands of breast and ultimately causes milk production. In night time, release of prolactin is more. So, night feeding is also very important. Oxytocin reflex. Oxytocin responsible for ejection of milk. Same, baby suckling, impulses goes to the posterior pituitary. Oxytocin released from posterior pituitary and prolactin from anterior pituitary. Then the other factors like baby's thought, sight or sound stimulates this reflex. That's why rooming in of mother and baby is very important. After delivery, always keep the baby and mother in same room, okay? Because baby's thought, baby's sound, sight stimulates this oxytocin reflex. And tension, lack of confidence, pain, lack of sleep, all of these hinders the milk flow. Okay. What are the causes of insufficient breast milk and what are the remedies? Causes like delayed initiation of breastfeeding after birth. What is the remedy? Start breastfeeding immediately after vaginal delivery or within 30 minutes of cesarean section. The dictum is as early as possible. Okay. And early skin to skin contact. Cracked or sore nipple. Cracked or sore nipple, positioning and attachment is very important. I will show in the next slides what are the correct positioning and correct attachment or latching. So, positioning and attachment is very important. Apply hind milk to the nipple, and for pain we can give oral analgesics. Supplementary feeding. Avoid any supplementary feeding like maybe honey, water, formula feeding, anything is to be avoided. Infrequent night feeding. Frequent night feeding we have to advise because yes, prolactin, secretion of prolactin is more during night time. So, frequent night feeding. Then engorged breast. Then also positioning and attachment to be correct, and this is for prevention, positioning and attachment, and treatment, hot fomentation, massaging the breast, frequent breastfeeding. If not possible, then we have to express the milk, and for pain, oral analgesics. Maternal stress, counsel the mother, because maternal stress hinders the oxytocin reflex. So, milk will not come out. Maternal illness or painful condition, specific treatment according to the condition, and pain alleviation, we have to reduce or subside the pain, what may be the cause, and less sleep. So, ensure proper sleep and proper rest. So, the stress, pain, sleep all hinders the oxytocin reflex. Reflexes, neonatal reflexes, rooting reflex, suckling reflex, swallowing reflex. What is rooting reflex? When something touches the baby's cheek or side of the mouth, then immediately neonate turns his head towards mother, open his mouth and searches the nipple. Okay, that is the rooting reflex. What is suckling reflex? Tongue presses the nipple and areola, not only nipple, both nipple and areola. If baby presses only nipple, then nipple sore will happen. So, presses both the nipple and areola against the palate and squeezing the underlying sinuses, lactiferous sinuses. Okay. Then swallowing reflex. When the baby's mouth is filled with milk, it starts swallowing. So, suck and swallow coordination is very important, and swallowing reflex comes earlier than sucking reflex. Okay. So, when a baby can suck the breast, that means he or she can swallow the milk. Now, maturation of breastfeeding reflexes. Okay. In 28 weeks, all these reflexes are absent. From 32 weeks, we will get the reflexes, but weak reflexes, rooting, sucking, swallowing. Okay. That's why when a baby is born before 32 weeks, we start OG feeding, orogastric tube feeding, or KS feeding, cup spoon feeding. Okay. From 34 weeks, the rooting reflex is present, sucking reflex is still weak, and swallowing less frequently, interruption of respiration. Swallowing reflex in 32 weeks associated with a pause in respiration. When the baby tries to swallow the milk, there will be pause in respiration. That pause in 34 weeks will be less frequent. All reflexes are strong. Suck swallow coordination is good because this is 38 weeks term baby. Composition of breast milk. First, colostrum secreted during the first few days after delivery. That is yellow and thick milk. Okay. Don't discard that milk. Okay. Because it contains antibodies, immune competent cells and vitamins A, D, E, K. Okay. Then after colostrum comes transitional milk from 3-4 days after delivery until 2 weeks. Here immunoglobulin and protein content decreases, but fat and sugar content increases in transitional milk. Okay. Notice the changes in milk, what contents are getting decreased and what are getting increased. Okay. Then mature milk. Mature milk comes after transitional milk, that is thinner and watery. And in preterm milk contains more proteins, as I earlier said, 1.8 to around 2.2 gram per deciliter, but normal term milk 0.8 to 1.1 gram per deciliter. So, higher protein content in preterm milk because that is needed for the preterm baby. So, more protein, sodium, iron, immunoglobulin and more calories. Okay. Foremilk and hindmilk. Foremilk secreted at the starting of feed, and after part hindmilk. Now, foremilk is more watery and high in protein, sugar, vitamin, minerals. This is more watery to meet the baby's thirst. Okay. And hind milk, this is richer in fat, so provides more energy and a sense of satiety. Okay. First to meet the thirst, then satiety. That's why when a baby is feeding, then complete emptying of one breast is essential before going to the opposite breast or other breast. Okay. Otherwise, the baby will not get both foremilk and hind milk. Now, positioning. Correct positioning of mother and baby both are essential for successful breastfeeding. So, what will be the position of the mother? Any comfortable position. She can sit, she can lie down. Her back should be well supported and she should not lean on her neonate. Okay. So, different posture by mother during breastfeeding. You can see the back is well supported everywhere. And mother should not lean on her neonate. Now, position of the baby. Firstly, baby's whole body is supported. Then, baby's head and body are in one line. There should be no twisting in between, in the neck. Okay, there should be no twisting. Head and body will be in one line. Then, baby's body turned towards the mother. It's not like the only baby's head turns towards the mother. Whole body should be turned towards the mother. And baby's nose is at the level of nipple. See, these are common breastfeeding positions. Okay. This is cradle hold. This is cross cradle hold, football hold, laid back position and side lying position. Now, notice the differences. This is cradle hold. This is the classic breastfeeding position. Okay. Here, the baby is getting feed from left side of breast. Okay. And the mother supports the baby with her left hand. And the head is supported in the elbow, crook of the hand, the curvature. Okay. Opposite cross cradle hold, here the baby is feeding right side of breast, but the baby is getting support with the opposite hand. Here left side of breast baby is feeding and getting support from left side of hand, same side. Here opposite, baby is getting feed from right side of breast, but baby is supported by left hand. Okay. And this is football hold or rugby hold. Mainly this is great for twins. One baby from this side and opposite twins other baby from this side. So, for both twins, when the mother has to feed, then this position is more comfortable, football hold. This is laid back position. Here the mother should not be, position of the mother should not be flat. This is like propped up position. Okay. These laid back position and side lying position, there the mother should notice that the baby's nose should not be blocked. Here there is a chance of baby's nose blocking. So, this laid back position and side lying position, mother should be enough careful. Okay. But most common position is cradle hold position. Here the baby whole body is well supported. Okay. And whole body is turned towards the mother, not only the head. Okay. Attachment or latching. What are the signs of good attachment? baby's mouth will be wide open, so that both nipple and areola comes under mouth. Then most of the nipple and areola in the mouth, only part of upper areola visible. Lower areola should not be visible. Baby's chin touches the breast and baby's lower lip is everted. Okay, see the picture. Here, this is good attachment. Lower part of areola is not visible. Only the upper part of areola is visible. Both nipple and part of areola is inside the baby's mouth. Baby's chin touching the breast. Okay. Here, both upper and lower areola visible. Only the nipple is inside baby's mouth. So, this is poor attachment. These are steps of breast milk expression for expressed breast milk, EBM. Okay. When a mother is sick or in case of multiple birth, then there is need of expressed breast milk. So, how to express the breast milk? First, massage the breast gently towards the nipple. First, we have to massage the breast. Then, place the thumb and index finger opposite each other just outside the areola. This is areola round, and place the thumb and index finger opposite the just outside the areola. Then press back towards the chest. Okay, with the help of thumb and index finger, press back towards the chest. So milk will come out. Then gently squeeze to release milk. And repeat step 3 in different directions. Like here the thumb and index finger are in 12 and 6 o'clock position. Then change the position. Here the thumb and index finger is 3 and 9 o'clock position. So change the position and squeeze the breast, milk will come out. Inverted nipples. Flat or small nipples which will be prominent when pulls out, but these don't cause any difficulty in breastfeeding. Can make latching difficult. In inverted or flat nipple, attachment of the baby with nipple and areola or breast will be difficult, but no difficulty in breastfeeding. This is flat nipple, this is inverted nipple. So, there is no proper nipple outside for the attachment. So, attachment will be difficult. Treatment, how to treat? Pulling out the nipple and rolling it between finger and thumb several times. It has to be done from the antenatal period. Okay. So, if there is any abnormality in nipple, that to be discovered in during antenatal period. It's not like after delivery we will see. And cut plastic syringe can be used. How? I am showing. This is a syringe. Okay. Cut this portion of a syringe. Okay. So syringe will be like this. And this piston, remove this side from this piston from this side and enters the opposite side. Then attach it in the nipple and areola region. Then if you pull this piston, the milk will come out. খুব ইজি প্রসিডিওর, এটা নিজে করলে বেটার বুঝতে পারবে। ঠিক আছে, জাস্ট সিরিঞ্জ কেটে পিস্টনটা যেদিকে আছে বের করে অপোজিট সাইডে ঢুকিয়ে দিতে হবে, তারপরে এরিওলাতে লাগিয়ে প্রেস করলেই সুন্দর মিল্ক চলে আসবে। কারণ বেসিক্যালি বেবিও সেম মেকানিজমে ইয়ে করে, টাং আর প্যালেটের মাঝে এরিওলাকে প্রেস করে ল্যাক্টিফেরাস সাইনাস স্কুইজ করে ব্রেস্ট মিল্ক চলে আসে, এখানেও সেম মেকানিজম। Sore nipple. When neonate sucks only nipple instead of both nipple and areola. Okay. That's why I am repeatedly telling that whenever the baby or newborn sucks, sucking of both nipple and areola is important. And we have to counsel or teach mainly the primary mothers. Okay. And incorrect attachment. If sucks only nipple, that attachment will be incorrect. So baby will not get milk. So baby will suck vigorously because baby is hungry. Then bites on the nipple, it will cause nipple sore. It also caused due to frequent washing with soap. Okay. Frequent washing of breast with soap is not required. Only during bathing wash the breast, that is enough. Treatment, correct positioning and correct attachment. Breast engorgement. In delayed or infrequent feeding, what will happen? Milk will be collected in the breast, so breast will be engorged. In incorrect attachment or positioning, also breast will be collected, milk will not come out. Then breast becomes hard, warm and tender. How to prevent? Early and frequent feeding, every 2 hourly feeding. Okay. And treatment, hot fomentation, massage, frequent feeding. If feeding is not possible, then expression of milk and analgesics for pain. So this is breast, engorged breast. Okay. The skin is tense and shiny because milk is accumulated inside the breast. Then breast abscess. When engorged breast, cracked nipple, mastitis not treated earlier, then the consequences will be breast abscess. Patient will come with high grade fever, malaise, breast inflammation, inflamed breast. How to treat? Analgesics and incision and drainage. Okay, if possible, breastfeeding to be continued. Okay, if mother is okay, then we will allow breastfeeding. So successful breastfeeding, how to do breastfeeding successfully? First, motivate the mother from the antenatal period and diagnose if there is any abnormality in nipple, crack, inverted, flat, whatever. Start early. Start breastfeeding as early as possible. Then rooming in of mother and baby is very essential. Then frequency, breastfeeding at regular frequency. Okay. Then avoid prelacteal feeds, means water, honey, formula, whatever is to be avoided. Avoid bottle feeds, because what are the disadvantages of bottle feeding? First, baby will confuse the bottle with nipple, with mother's nipple. Both are of same type, so baby will confuse. Then there is more chances of infection, more chances of diarrhea. Okay, so bottle feeding to be avoided. Feeding from both breast. After emptying one breast, then another. In alternate feeding, the feeding should be from alternate breast. Duration of exclusive breastfeeding, up to 6 months, breastfeeding to be given exclusively. Then cleaning the breast, repeated frequent washing is not required, only during bathing, cleaning of the breast is enough. And complementary feeding starts from 6 months of life up to 2 years breastfeeding plus complementary feeding. So these are around 10 steps of successful breastfeeding. Now human milk banking. For whom? For preterm and sick babies. Not getting mother's own milk due to separation or maternal illness, whatever the reason, baby is not getting mother's own milk. Mother unable to offer breast milk due to health risk. Okay, suppose mother is getting anti-thyroid, anti-cancer drugs, so mother can give her own milk. In that case, human milk banking is essential. In adopted babies, mother is not available. Babies whose mother have died in postmortem period, again mother's milk is not available. And multiple births. In multiple births, sometimes the mother's own milk is not sufficient for all the babies. In that case, human milk banking is essential, where we can get pasteurized donor human milk. World Breastfeeding Week we celebrate every year here in Santiniketan Medical College also. That is from 1st to 7th August.